All right, so this is going to be a rundown of common sleep disorders. So, first one is going to be sleep deprivation, and the definition of that would be a lack of adequate sleep over a quantity amount of time, and also not getting good quality sleep. So, symptoms would be fatigue, irritability, poor concentration skills, mood swings. And then causes would be stress, things like college, work, studying. Um, if you have a kid, I'd assume that you'd be sleep deprived. Um, and also disruption of your body's natural circadian rhythm is also one. Treatment would be good sleep hygiene, so having consistent bedtime, limiting caffeine at night, creating a dark environment, not being on your phone close to bedtime, and if you need to, you could take something for insomnia. So that leads to the next disorder, which is called insomnia, and that's the difficulty falling asleep, staying asleep, or like waking up too early. So symptoms would be fatigue, poor focus, difficulty concentrating, mood, like your mood's gonna change. So you might be either like, I don't know, like too sad, like you might have feelings of depression or like paranoia, kind of like mood disorders, and low energy. So causes are stress, anxiety, depression, hormonal changes, elevated cortisol is one as well. Some treatment for that is good sleep hygiene. You can take medications if needed and if necessary. And you can also do cognitive behavioral therapy for insomnia as well. Next one is sleep apnea. So, sleep apnea is basically repeated pauses in breathing during sleep. And the symptoms for that are loud snoring, gasping, choking, morning fatigue, morning headaches, daytime sleepiness, not feeling well rested. So the causes depend on the type. So for obstructive sleep apnea, the causes are like basically it's like your airway, it's like relaxed throat muscles that block the airway. And that's more common in like overweight patients. And then the second type would be the central type, and that's when the brain fails to send signals to breathing muscles. And in patients with sleep apnea, their oxygen does drop when they're sleeping, and it does put extra stress on the heart and on your brain as well. So treatment would be a CPAP, which stands for continuous positive airway pressure, and those are kept at the bedside. Some of them you put water in, some you don't. And it kind of fits like a mask that goes over. It depends on the CPAP, but like some of them just go over the mouth and the nose. Some go over just the nose, and they basically just help keep that airway nice and open. Also, treatment would be avoiding things that cause or make sleep apnea worse. So, avoiding alcohol, keeping a healthy weight is important as well. Next one is narcolepsy. So narcolepsy is the definition of it is the brain's inability to regulate sleep-wake cycles properly. So symptoms are daytime sleep attacks, sudden muscle weakness, sleep paralysis, and hallucinations. So causes, autoimmune. So the causes are the autoimmune loss of hypocretin, which disrupts the REM cycle of sleep. Treatment would be taking stimulant medications and also scheduled naps and avoiding heavy meals and alcohols before bedtime. And they are going to be at a higher risk for falls. And then next one is hypersomnia. So definition of that one is excessive sleepiness despite adequate or prolonged sleep. Symptoms are long nighttime sleep, trouble waking up, daytime naps, and confusion. So causes, so they can be neurological conditions like depression, head injury, or like a subarachnoid hemorrhage, or idiopathic causes. And basically it's caused because of a dysregulation of sleep-wake neurotransmitters like dopamine and serotonin. So treatment would be stimulant medications, regular sleep cycle, and treating the underlying medical or psychiatric condition. So restless leg syndrome, so the definition of that is uncomfortable sensations in the legs and an urge to move them, especially at night. So symptoms include tingling, burning, muscle spasms, or aching in the legs that only improve with movement. So causes could be like low dopamine activity in the brain, iron deficiencies, pregnancies, or chronic conditions like kidney disease. Some treatments for that are iron supplements. A lot of the times patients take medications like Requip that kind of help treat restless leg syndromes. Medications that are going to boost dopamine and avoiding things like caffeine, nicotine, and alcohol, and stretching the leg muscles out before bedtime can also help with it. So in patients with all kinds of sleep disorders, they are going to be at a higher risk for, well, depending on the sleep disorder, but one thing you always want to monitor is their oxygenation, especially at nighttime. And you also want to be making sure that they could be a fall risk, so you want to make sure that the bed is locked and that you're doing frequent rounds on them. And that's it.